This meeting is being recorded.
There we go. Hello, everybody, and welcome. My name is Wendy Myers, and I am the program coordinator for the EPIC program at Westchester University of Pennsylvania. EPIC, which is the acronym for Education and Programming in Integrated Care, is a program at Westchester University of Pennsylvania that is funded by a $1.9 million Health and Resource Services Administration Behavioral Health Workforce Education and Training federal grant. And that's quite a mouthful, which is why we've branded it EPIC. Through a competitive application process, EPIC awards $10,000 stipends to MSW and MED school counseling students and $25,000 stipends to PsyD students who are training in behavioral health settings with children, adolescents, and transitional-aged youth. I am here today to talk to two EPIC alumni who are currently supervising two EPIC students. This is the first time we have had EPIC alumni working directly with current EPIC students, and we wanted to hear from them about how the program has affected their supervisory relationship and education. Today, we are speaking with Jordan Cunningham and Anamika Anand and their students Brad Schmidinger and Micailla Fitzpatrick. And I hope I've pronounced them all correctly. And if I didn't, please correct it when you introduce yourselves. Jordan is a licensed clinical social worker currently working at Nemours Children's Hospital in Delaware, serving the pediatric population. She provides supportive services to children, adolescents, and their families during critical illness, psychiatric emergencies, admissions, and hospitalization, and works in both the inpatient and outpatient settings within the hospital. She obtained her master's degree of social work at Westchester University in 2019 and is a previous student in the EPIC program. Brad Schmidinger is a Master of Social Work student at Westchester University and is currently in the EPIC program. We also have Anamika Anand. She is the school counselor at Paul Fly Elementary School in the Norristown Area School District. This is her fourth year as a school counselor and her 16th year in education. Prior to being a counselor, she was a special education teacher. Anamika attained her Master of Education in School Counseling at Westchester University in 2018 and is also a previous student of the EPIC program, and she was actually in our inaugural cohort of the EPIC program. Micailla Fitzpatrick is a Master of Education School Counseling student at Westchester University and is also currently in the EPIC program. So welcome to all of you, and I really thank you very much for being here today.
Thank you.
So I am going to start with the first question. We're going to jump right into this. And Anamika, I'll have you start, I guess. Tell us about the setting in which you work and what specifically you do beyond kind of what I just talked about in your introduction.
So I'm in the Norristown Area School District, and I'm at Paul Fly Elementary School, which is a kindergarten through fourth grade elementary school. We are a Title I school as well. My job duties include anywhere from attendance, checking on children. I do check-ins in the morning with a lot of our kids. We are starting to do our small groups with kids. I go into the classrooms monthly to do classroom lessons. I do a lot of agency referrals in our community for our families. We'll work on doing community events to get our agencies to come into school. And the list honestly goes on and on. It's always changing. It's every day is a different day. You just have to kind of roll with the punches and have your sneakers on and just be kind of ready to go.
Great. Jordan, I'll ask you the same question. What more specifically you do at AI DuPont Nemours?
Sure. So we kind of the same thing. It really differs by the day, and it's always ever changing our job description. So we kind of just go with the flow. We're ready to go. I'm a coverage social worker, so I cover the entire hospital. So that includes vacancies, if somebody's absent for the day, if there's a certain area that's a higher census or population. So I really kind of have a skill set that's moldable to whatever the day brings, which is a good experience for students, a good experience for me as well. But we do a lot. So we do psychosocial assessments. We handle our mental health population when they come in, doing level of care recommendations. We do the outpatient setting, so follow-up phone calls, kind of just making sure everybody's okay. Everybody's okay with follow-up appointments, whatever's needed, hospitalizations, that disruption in routines. So we really kind of do all areas and help wherever's needed.
That's great. And I'll inject a small personal note here. I had a son who went to AI DuPont Nemours for services when he was younger. And because he had multiple diagnoses, I really enjoyed that DuPont's integrated care was, if you had multiple diagnoses, they insisted that you saw behavioral health because it was part of their package. It was part of their integrated care package. And that's one reason we're really pleased to have both schools who are an integrated health setting just under themselves, and DuPont, which is so invested in integrated care, have them both as partners within the program. So I really appreciate that. Tell each of you, and you can decide who goes first, I suppose. Tell us about your EPIC experience, realizing that this was, what is it now, 6 and 7 years ago, I think, 5. I mean, it's been a little bit since we've started this program. And how it prepared you for the setting in which you're currently working and the responsibilities that you have.
You can go first.
Okay, thank you. So like Wendy mentioned, I was in one of the first, I guess it was the first one that they had. And I was the first school counselor, and it was all social workers. So it was very new to me. Just even understanding the role of a social worker. So I got to really meet so many different people, and just like hearing about their experiences, but I did not even understand what integrated care settings were at the time. And I feel through the EPIC program, I got a really great opportunity to understand and learn more about it. And not realizing, like I said, I was a special ed teacher in the past, not realizing we are such an integrated care setting in our school. And on a daily basis, really working with so many different professionals in the building, speech, different related services, psychologists, my school nurse, different teachers, different specialists. And then there's everybody in the community where like agencies, if, there's families have caseworkers as well. So I just didn't realize how much I was doing. And I think just being in that program really helped me learn more about some of the different fields of people that you're supposed to be working with, and especially in the community for me, making those connections. So I think that was really, really beneficial for me. And I feel like that's been such a big goal of mine as a school counselor, is really bringing in all those people. And I feel like I'm setting up meetings all the time when you're meeting about a student and something's going on with a student, it's just so important to have all the right people at that meeting. So I think that's really where it's helped me a lot.
I think I'll follow that too. And that integrative care, you really don't realize how many different disciplines you're really working with. The hospital setting, I mean, you could work with 15 different disciplines from different areas, and just how to kind of work with each discipline, understanding what they do and understanding your job description too, and kind of bringing it all together for the family or for the patient or for, the student, whoever it is. The EPIC program really kind of helped to understand how to work with different disciplines in the integrated care team. I think a lot of the trainings too were really helpful, and 2 really stood out to me. I was going back through all the trainings that we did when I was in the program. We did a suicide awareness and prevention training, which is helpful for, I think, any area, but in the hospital, we do a lot of mental health assessments, a lot of level of care recommendations, and working with that population. The other one we actually did was a neuroscience and evidence-based practice for treating substance use. And we don't get a lot of substance use here. Sometimes in our adolescents we do, but that training specifically focused on trauma, and that we obviously work with a lot, no matter where we are, but the hospital especially is a lot of trauma coming in that we see. So how the brain works and doing that. So that training, both of those trainings really stood out during that program and kind of helped me to where I am today.
Thanks. Yeah, and our trainings continue and are open to, this is for the benefit of those watching, are open to the public. And we have a lot of our alums come back and take those trainings to help maintain their licensure. I know, Jordan, you do that. And we do these 4 trainings a year that are geared toward not only our students in the program, but also toward professionals out in the field. So you kind of answered this question already, Jordan. I don't know if Anamika, if you want to jump in on this, but the next question I had was, were there any specific learning experiences that you remember from your time in the EPIC program? And have you then been able to use those experiences specifically in your profession?
So for me, the one that really stuck out for me, I agree that the trainings were extremely beneficial. But the one that really stood out for me was when we got to do that visit to the integrated care setting. I remember it wasn't too far. We went to 2 different offices, and just to see, like, from the medical side more, like how it was like a practitioner and the different specialties and how they were all working together. That was really eye-opening for me because I don't see it outside. So we work with kids and families all the time on the medication piece, right? So I have a case right now, and it just helped me understand a little bit more for the family, like where they're coming from and how I can help support them a lot better. So I loved that field trip. It really did stick out for me. It was a really eye-opening experience for me.
Jordan, did you want to add anything? Or did you kind of summarize it in the last question?
I did kind of summarize 2 questions in one, but I actually forgot about the field trip until she just mentioned that, and everything like flashed back to how helpful that was too. So I definitely agree. That was an awesome idea to kind of put together to see, from a different perspective too. I think it was great.
Great. Have you had the ability to discuss your EPIC experience with your colleagues, with your coworkers?
Yes, I have. I've actually brought it up at like my counselor meetings before. And one of our school counselor's daughter was an EPIC student last school year. So it actually has come up a few times, which has been just really great to share that information, share the professional development opportunities that you guys have offered as well.
I actually had 2 colleagues that went to Westchester and went through the EPIC program as well. So one actually worked in primary care and one actually worked with me at the hospital. So it was really nice to kind of have that cohort of people that kind of you follow with.
Yeah. Wow. I didn't realize there were that many connections to EPIC already out there. And that's great. I mean, I think we're now over 140 students who have gone through the program. I could be off on that number, but it's probably about in there. So I guess when I think of it in that perspective, I'm like, oh, wow, we are really kind of getting the students out there. And that's exactly what HRSA wants us to do with it. So that's great. All right, I'm going to have Jordan, I'll start with you. I'm going to have you introduce your student. And as you do so, Brad and Micailla, just talk a little bit, even though it's beginning of the academic year and you haven't done a whole lot yet with EPIC, just kind of talk about what your experience with EPIC has been like so far.
Sure. So this is Brad. He's obviously a student at Westchester University. We're in month 2 of our field placement. So far he's done a lot of different assessments independently and been able to do follow-up phone calls, some assessments, psychosocial assessments. So he really has his foot in the door already. So we're really excited to see how it goes.
Yeah, so far, just at Nemours, it's been a good experience overall so far. I've really liked the work I've been doing, especially like the clinical aspects of it. It's something that in my previous field placement, it didn't really have as much of it. So I like that opportunity to do that. And also having other interns here just kind of going through it with me in the social work program has been super beneficial. Just having, at the very least, someone you can vent to who understands what you're going through. It's been amazing. As far as the EPIC trainings and the program I'm going through so far, I think at this point we've only done one online training that's EPIC oriented. The writing letters of gender affirming care. We had a training with, it was Dr. Hippel and another person whose name is escaping me right now, but I like the introductionary aspect of that so far. It's definitely the trainings are definitely things that I don't think you would really experience as much in a traditional setting. They kind of take a lot of essential and important topics to understand and like digress it into I guess understandable material that you wouldn't really have the benefit of traditionally learning in your placement. So I think so far it's been helpful. I'm really looking forward to the next one. I think it's talking about reproductive rights post Dobbs decision, and that's going to be like really key information to go over.
Anamika? Yeah.
Micailla Fitzpatrick. She is in her first internship. She'll be doing her second internship in the spring for her secondary, and she will be graduating in May. Turn it over to you.
Yeah. So the EPIC experience so far has been amazing. The training was really helpful. You don't really learn that kind of information in class, so it's just getting more understanding. And then even applying it now, like you're working and speaking with different professionals and also gaining like resources for when you're done school and how you can help kids when you get out. So it's been awesome to have that connection there too. And you're really getting a more holistic approach with those trainings and how they can be applied within the school setting. So that's been a great experience so far.
Great. Thank you. I know that our trainings, we are trying to do exactly what you both have said. We're trying to get trainings that aren't things you would normally learn in a classroom and try to make them topical for what's going on right now. So writing letter for transgender adolescents, writing letters for gender affirmation surgery. It's not something you're generally going to be learning about in classes, but as behavioral health professionals, we are going to be coming up with, have clients and students who have these concerns and have these questions. So we do try to get our trainings to be something that you're not going to get otherwise. What's the point of having a training that you would already be learning in the classroom? So that's good to hear. For the students, what are you most looking forward to this year?
I can go. Really getting that hands-on experience, not only in the classroom, but in the field experience as well, and really getting to apply those things that we're learning in class, as well as what we're gaining through the EPIC trainings and everything. And then also sharing that information with our colleagues who maybe don't have time to come to the trainings or whatnot. So you can really approach a lot of people with what you're learning. And then running groups and collaborating with the team in the school setting to have that really integrated care setting and putting that into place. So that's been what I've been looking forward to so far.
I might just reiterate a lot of what Micailla just said, but a lot of it's so similar. I'm really looking forward to working with the patients here at the hospital, both one-on-one and then in a familial setting, and then going over just the integrated care that they experience, and then also getting to know the social work team here more, because it is something that thinking about career-wise. So I think getting in like meshing well with this team, I think it's going to be really beneficial.
Great. One other question for the students. Have you had a chance to discuss your EPIC Supervisors experience and how that's affecting your role as a student, if at all, if it is affecting your role?
So we have talked about Jordan's EPIC experience. It's definitely a better understanding of how the year is going to go. And I think we both agreed that just the added, I think, responsibilities of the EPIC program are definitely applicable to real life social work when we get out of the education. We graduate and then we really start working. I think it's also, I think we've said a couple times, but just the stuff you learn there is stuff you wouldn't really have the opportunity to learn anywhere else.
Yeah, we've definitely talked about EPIC trainings, and it's very beneficial because although we're not going through the same trainings from before, we're able to collaborate and kind of work both trainings in and bounce ideas off each other and really go off of comparing trainings and still gaining information about ideas and techniques and stuff like that that we're learning now, and then also still having that information from before. So that's been awesome to kind of share that same experience.
Well, and it's interesting to me, both of you as supervisors had pre-COVID EPIC program, and both of you students are having post-COVID EPIC programming. And of course, it had to change dramatically during the whole COVID thing. So we moved all of our trainings online now, which has been great in the sense that we've been able to expand our trainings to a lot more people, but it isn't as intimate and it isn't as you don't get the chance to interact as much as you do when it's live. So, it's kind of, we get some benefits, there's always that cost benefit model. And the same with the classes, in person versus online. And I think now the class has been moved to 2 weeks instead of a 1 week intensive. And and it's part online, part offline, it's part asynchronous, part synchronous. So there's a lot of changes that have happened between Jordan and Anamika's time in the EPIC program versus now. So it must be interesting to kind of compare and contrast that as well.
Absolutely.
Yeah. For all of you, what benefits do you think you have by having an EPIC student and EPIC supervisor working relationship? And you may have kind of covered this in previous answers as well.
I think it's beneficial not only for many reasons, but one thing, and Brad kind of mentioned this, is that it is almost an increase in workload. You have more trainings, you have another class, you have different things that you have to go through, which can be taxing when you're probably working another job, you're doing your internship, you're doing your regular classes. So I think having that support is able to help them too, to be like, okay, somebody else went through this. I'm not alone in this. I can do this. But then also coming back and being like, wow, that was super beneficial. And how can we apply it to here and the work that we're doing here at the hospital too?
And just to piggyback on, oh, I'm sorry, go ahead.
No, I was gonna just add on that it's a big thing to have someone who's actually also gone through the EPIC experience, because it's having someone understand like everything you're going through just through lived experience. So it goes beyond like sympathizing with someone or empathizing with someone. So it's better to have like a supervisor who really gets it, and it can be someone who like you can share your frustrations with or like ask questions about, and they can have like informed answers, and it's just really great.
I was going to also just add to that it's a really nice common ground to have, that you're both coming in with that experience and we are able to relate. And I think it really helps also just being so busy, because it is a lot, like you guys are doing a lot right now, but it also shows you a little bit about what life is going to be like, like later. It's managing lots of different things. And as a school counselor, as a social worker as well, like you're still always in professional development. You're always learning. So I think it just really shows a little bit of what it is going to be like later.
Also, like during that similar experience, but post-graduation, you'll still have that mentor to, maybe even attend trainings together and still collaborate, regardless of not being in the same location. I think that'll be a great connection to continue to have. And then we can continue to apply trainings throughout our profession. So I think that's going to be a cool experience as well.
Cool. All right, final question, but that doesn't mean you have to stop talking about your experience if you want. What would, well, and this, I guess this final question kind of does do that. What would you like the general public to know overall about the EPIC program?
Well, I was going to say just, I think one of the goals of the EPIC program is just educating about integrated care settings. And I think I have friends in like different professions, and I have a really good friend who is a physician. And it's so great to have those conversations because I've been educated about it. And like I said before, I had no idea I'm in a setting like that, but I didn't realize what it was called. So I think just, you know, continuing to have professional developments and finding ways to, you know, get more people involved in the community so they are educated and there is the awareness of it out there.
I think that's a really good point too. And I think it really opens your eyes to that integrative care, kind of like how we were saying earlier. But in so many, even professionally and personally, you know, like you go to a doctor's appointment and you're like, do you guys have a social worker that works here? Like, how does your team work? Like you start to pick up on it in different areas of, you know, are you guys working as an integrative care team? And you start to really realize it in other areas just because you have that background and that training. But it's beneficial, you know, both personally and professionally too.
Do Brad and Micailla, do you have anything that you feel, even though, again, I realize this is the beginning of your academic year, so there's still a lot more to experience, but is there anything to the general public that you wish that they knew about the EPIC program?
Just how beneficial it is to really keep an open mind and see everyone's point of view through conversations, regardless of your profession. Just understanding that there's more to learn, I would say.
I think also that some of the topics that we think are more simple or easier to understand are actually can be very complex and have a lot of different aspects that need to go into it, and they're important to explore.
Great. Any final comments before we wrap up here? Nope, we're good. All right. Well, I want to thank all of you so much for doing this. I'm super excited that we're coming full circle on EPIC supervisors and EPIC students, and just the idea that there's just so many epically trained students, I guess. Is that a word? I'm making that a word.
I like that.
Do you? Okay. Out there, and that we're doing what HRSA's asked us to do, and that's get behavioral health specialists who are trained in integrated care out into the community and getting the community aware of how integrated care is just so much better for our population, not only for behavioral health, but for all health. And just really appreciate everything that you guys have done and are doing, and the leaders that you both were within your own cohorts and continue to be out in the professional world. I just want to thank you and really appreciate it. And I want to thank everybody listening. And if you have any questions about EPIC, please feel free to reach out and we can talk to you more about it. Thank you.
Thank you so much, Wendy.
Thank you.
Thank you.